Transvaginal sonography or internal ultrasound is very important. It's caused by a virus, 90% of the cervical cancer. Vaccine which can prevent the cervical cancer from happening.
Dr. Roza Olyai, a senior obstetrician and gynecologist.
When you mentioned about WHO, so I was part of making a global guidelines in Geneva for the developing countries to decrease the teenage pregnancies. This insulin goes to sleep with the sunset.
Oh,
That
is
means,
it?
yeah.
If you have had a history of cancer, then also you don't need to get it done, or
But 90% of us carry this virus.
what simple habits can reduce the risk of gynecological cancers?
That means gut is your second brain. I think shopping is something, Sangita, I always tell my patients, one way to de-stress. They
Guys,
hear me.
you know, all women are going to love you for this advice. Namaskar and welcome to Warrior Voices with Sangita, a space where stories of strength, hope, and healing come alive. Today's episode is all about prevention because when it comes to cancer, awareness truly saves lives. I'm joined by an incredible guest, Dr. Roza Olyai, a senior obstetrician and gynecologist, director of Olyai Hospital in Gwalior, and a national leader in women's health initiatives with FOGSI and the Family Planning Association of India. She has also been a consultant at WHO Geneva. She has authored 4 books and co-authored 8. She also has been a recipient of prestigious DC Datta Award for the Best Publication in 2011. With over 100 research publications and decades of service, Dr. Olyai has been a strong voice for women's health and cancer prevention. Dr. Roza, welcome to Warrior Voices with Sangita.
Hello, Sangita. How are you? Such a pleasure to be with you here. Thank you for inviting me.
Dr. Roza, you've had such a distinguished career in women's health. What are the most common cancers affecting women today, and why is early detection so critical?
So, Sangita, we're living in a world which is at odds with itself. And there are so many diseases. Now, if you say cancer, when you talk about in women, especially, which is my domain as a gynecologist, cancer is not preventable. It happens. But there are ways, that you can make it to be detected easily. And the reason why in women it's important, because right now, if you see, breast cancer is on the rise. Years back, it was cervical cancer. But now, if you see, there is 26% of the women in India, if you talk about India, are having breast cancer. And then you come next will be cervical cancer, which is a mouth of the uterus when we talk about. This was a leading cancer all over the world. Right now, it's the second most, with 17.7% of women being in India affected. In women, the third would be in order 6% with ovarian cancer.
Are there any early signs or subtle symptoms women often ignore and could indicate something serious?
And let's talk about breast cancer first. So if in a woman you find usually there is something abnormal in your breast in form of a little lump, or there's a little bit of change in size, we often stand in front of the mirror. We often try to wear our clothes. But why not during bathing or saying, touch yourself and see? I'll come to that later on. But change in size, the nipple, the discharge that comes from there sometimes, besides milk, could be watery or with blood stain. Sometimes a nipple gets retracted within inside. Later stages of breast cancer would be something like the skin would be a little more painful on that side. There is reddish discoloration. It's a little warm. And then the swelling of the underarm is also another sign, but that comes in later stage. So the beginning could be very subtle, but again, you will come to know there is something abnormal.
Pain, where did you say? Pain in the breast or in the skin? On the skin?
On the area where it's affected. So that area which is affected in this breast could be painful.
Okay.
not necessarily the whole breast, because something, Sangita, we have in terms of premenstrual syndrome where the both breasts get pain and engorge. So that's very different. That's very
Mm.
normal. That's very physiological. That is related with the progesterone and
And
estrogen
what
hormone.
kind of pain would that be? It would be a persistent pain, or would it be something that comes and goes?
So the pain would be, usually my patients come to me saying that, my son or my little boy, touched me, or, somebody boxed me or something happened. So I started feeling pain. So the pain is not going to be always there until you press it a little bit. So
Hmm.
that's what examining the breast from time to time is important. It's not going to, in the earliest stages, it's very subtle. So when you feel your breast, you will come to know there's some uneasiness, not in all the areas, but in certain quadrant. So this is with breast cancer.
Hmm.
When you talk about cervical cancer, because that's again is one of the leading causes, 70% of women in India get affected. So the early signs will again be little misleading in the sense the woman will experience white discharge. She will have in between menstrual cycle spotting. She will have bleeding after a sexual contact, sexual intercourse. So
Okay.
these are the beginning signs. And then she'll come to the doctor saying, I'm having a little foul smell, with my discharge, which is coming. So these are the very early signs in a woman with cervical cancer. So be very careful with white discharges. The ovarian is something which is quite difficult to diagnose. That's
Okay.
why I want through this video give a message to everyone that you must get yourself examined regularly, because you never come to know when the ovaries are having tumors. You never come to know about it. But in later on stages, you will have the patient will start having a little uneasiness in the lower abdomen. She will feel bloated, she will feel discomfort. And in later stages, if that goes, the ovarian cancer is a very good cancer to treat quickly. But in later stages, when it comes to your diaphragm, just below your chest, then difficulty in breathing, there is water in the stomach, as I must say, ascites in layman's terminology, and difficulty in passing urine, pain, defecation, and again, cachexia, that is loss of weight, loss of appetite. Later stages will not be too good.
How often
Yeah.
should women get screened for cervical and breast cancer? And what are the
Ah,
recommended tests?
so we have called something called breast self-examination. So a girl at the age of 20, I must say, you should start, knowing your breast. You should start examining yourself at least every month when you go for about a simple thing round your breast, you go and then you examine yourself. But once you age between 20 to 39, you must sometimes even visit your doctors. Maybe I would say a clinical breast examination. That means you go to a gynecologist. And that can be done if it's a normal case with no history of family cancer, everything is okay. Every 3 years, you should go to your doctor. Once you cross 40, I would say, you must go more often to your gynecologist so that the gynecologist can examine your breast every year. This is part and parcel of a woman after we say post, childbearing age. We finish our childbearing by 35, 36 years. So beyond 40, you need to be a little careful with your breast. Now, with the cervical cancer, there are certain tests. I'll make it very simplified. So when you go to a doctor, they can do a visual inspection of the cervix, and we do a test called VIA. So with that test, you come to know if there is any problem on the cervix, and those women, especially who got white discharge, who could do it. So if you're sexually active after the age of 20, 30, maybe when you finish your childbearing period, you can go this test very easily. Between 30 to, I would say, 56 years, it's very important to go and get yourself examined. And a pap smear, which is really something that can, avoid future complications, which could be done every 3 years. But beyond the age of 40, I would say annually if you can, especially for those women who have got white discharge, who have got, regularly itching, foul smell. So more often for them, maybe, annually you can go. And then, of course, the detection. If you're 65 years, Sangita, many women come to me that, we've got our test negative. So do we have to do again after 65? So if your 3 tests are negative, after 65, you don't have to do that because menopause has set in and you're beyond that. Luckily, no cancer of the cervix. Now, for ovarian, which I said is, something that you don't come
Sorry,
to know.
Rosa, can I interrupt you here? So you're saying after
Yeah.
65, which cancer, cervical cancer possibility is lesser?
Yeah, cervical cancer. Yeah, cervical cancer. If your 3 of your pap smear is normal, so we do a pap smear, Sangita, for a cytology test. So it is a pap smear liquid-based cytology with a HPV DNA test. We do it together, and if those tests are negative, 3 consecutive tests are negative till the age of 65, then beyond that, you don't have to really get your pap smear done, and it's going
Okay.
to be a little painful. Yeah.
Yeah.
So coming to the next
Say,
cancer,
supposing if you have had an history of cancer, then also you don't need to get it done, or you need to get it done.
if your test is 3 negative, so your test should be negative.
Okay.
If it's not negative, then you have to again go annually and get it done.
Okay.
So that is a message. Yeah. So you have to be careful with that.
Mm.
So coming to the ovarian cancer, which is again very important, and I always tell my patients who are 30 years and above, you must get a transvaginal sonography done after the age of 30, 35. So with the TVS, we call it, we get to know the size of the ovary. Most often patients who come to me with ovarian tumors, these are physiological, they're not malignant, they are non-malignant. Not all ovarian tumors are malignant. They could be just a growth, but however, you never know how it's going to change into malignancy. So transvaginal sonography or internal ultrasound is very important. I would again say that many women go and do an abdominal ultrasound. There's a difference between an internal scan as well as an abdominal. For women, I would tell all my women listeners, transvaginal sonography is something that they should do, which is more diagnostic, more, easily done. However, if there is a tumor and your age is 35, you're worried about it, there is a blood test called CA125, which could be done. However, it is not routinely done until and unless we see the ultrasound report, we evaluate the patient, see the history of the patient, and then advise them. So ovarian tumors, I would say, don't worry about it. But the only thing you should do is after the age of 30, 35, get a scan done.
So what you're saying is for ovarian cancer, the sonography which is done normally above the abdominal sonography will not show it as easily as maybe the
Transvaginal scan, a
transvaginal.
TVS, yeah, a transvaginal scan. So we have 2 forms of scan which we do, which is good. So when a woman comes after she finished childbearing age, she's 35, 37, it's not a bad idea to get the scan of the whole abdomen, but also add a transvaginal which goes inside internally to the vagina. So that gives a good picture of the uterus and the ovaries because the distance is less. The probe is more sharp for this diagnosis. So all women, the take-home message would be always do a transvaginal sonography for any reason, for any matter.
You said prevention is not possible, but I have heard that in cervical cancer, first of all, we'd like to know what exactly cervical cancer, and for cervical cancer, some vaccination has come up, isn't it? So I want to know that is
Absolutely.
a preventive measure, right, for cervical
Yes,
cancer.
yes,
So
yes,
can you just
yes, yes.
explain to us first exactly what cervical cancer is and then how it happens, like what is the
Prevention.
reason and
So,
how you can
Sangeeta,
prevent it?
very good. Yeah, it's a very good question you've asked because, as I said earlier, cancer can come to you anytime. But we are lucky now. Today, in the world we are living, let me say 2025, we've got a vaccine which can prevent the cervical cancer from happening. So when you ask me what is cervical cancer is, it's caused by a virus. 90% of the cervical cancer is called with a virus called HPV virus. It is human papilloma virus, which has got about 200 different varieties. The most dangerous cancerous one would be number 6, 11, 16, and 18. I won't go into detail of it, more scientific. So there is a vaccine now that the girls can take as early as between the ages of 9 years till the age of 45 women. The doses of this vaccine differs, however. If we have time, I can do a little detail that the girls, like the Federation of Obstetrician Gynecologist Society of India, have come with a vaccination schedule. Girls between the ages of 9 to 14 years will get 2 doses of these vaccines. So suppose I give the dose today, 0. After 6 months, the second dose will be taken. But if the girl comes to me at the age of 15 or beyond, so the doses will be 0, 2, and 6. That means 3 doses. Now, there are many varieties of vaccine, Sangita, which have come. We are very lucky now. We are living, especially the young generation now. There is a quadrivalent vaccine, which is covering just 4 of these HPV variety serotypes. There is a one which is more now recently come, which covers 9 serotype. So that means a nanovalent is much effective, more coverage of the HPV virus. In India, we have 17.7% of the women getting involved in cervical cancer.
One type of cancer you can prevent.
Yes, absolutely.
But this cancer happens because of this human papilloma virus.
Papilloma virus.
Yeah.
Yes.
So from where does this virus, how does this infection happen or spread?
Good question, Sangita. So the way it spread is through skin contact. So you have to avoid from having multiple partners for sexual contact. So skin to skin, and it invades through the skin, invades through the mucous membrane of the cervix, the vagina, which is a place that it could just invade and go. Through oral sex, anal sex. So all these things tries to give. So let me also say, not to make everybody frightened, but 90% of us carry this virus, HPV. However, however, it doesn't show in all people, in all of us.
You
That
mean
means
it's dormant
nothing to
in us.
panic.
The virus is there, but it is dormant.
And so not all HPV viruses, as I said, 200 of them, not all are cancerous.
Okay.
Just few of them. Even wearing condom during sexual contact cannot prevent this cancer because the condom doesn't, cover the skin area. So this is something which is very important. All should know because this virus causes, even in men, penile cancer, anal cancer, throat cancer. So they also will harbor this infection. And if it invades, and so that's the reason why the earlier we give the vaccine to girls who have not had sexual contact, who do not go during ages of 9 to 15 years, any, dirt of a kind of a penetration in the cervix, any infection, they don't have during that period. So the chances of HPV getting into them is very less. Compared to a woman who's given childbirth, there is injury in the mouth of the cervix during a normal child delivery. That injury, if it harbors the infection, HPV virus, the virus can gradually climb up. Another thing I must say here, even if that patient gets one of those cancerous variety of the serotype, if they get that, for 5 years, 3 to 5 years, that remains dormant inside the cervix.
Okay.
But if you have multiple acts of sexual contact with a person, your immunity is down, you're smoking, alcohol, there are so many things related, then that will keep on invading. So you have a little white discharge, you have a little ulcer, you don't take care of it, you don't go to your gynecologist, you're not doing your pap smear on time, you're not doing the proper treatment, you're not treating the infection. That will again go within 10 years' time, grow up to be 100% cervical cancer, invasive cancer. When we know there is a cervical cancer vaccine, when we know that we have to avoid these things which I just mentioned and have a healthy lifestyle, a chaste lifestyle, you can avoid cervical cancer and get rid of it. And there's such a huge amount of burden in India.
But there are many people still very apprehensive because In my family also, one person has given this vaccination, and the other has not given to her daughter. So people are
There
apprehensive.
are a lot
So
of
what would you,
myths.
what
Yeah.
would you say to your parents and of young?
It's absolutely. So, Sangita, this vaccine is harmless. It's just like any other vaccine. We all were, vaccinated with corona vaccine, flu vaccine. Every year we are getting vaccinated. It's just same as that.
Okay.
There's a little pain. It's just like any other vaccine, a little redness, little muscle pain at the arms, but that's it. It's nothing to worry about. You can give this
Mm,
vaccine along with your tetanus vaccine.
mm,
You can give it along with your flu vaccine and corona vaccine. No harm. Nothing will happen. It's given on the arm here, upper arm, intramuscular, and that's it.
so
The myth is actually, that this may cause cancer. It will never cause cancer because it's not a live virus.
mm,
And also, nothing to do with your girl becoming pregnant, not pregnant, infertility,
mm,
nothing to do. Menstrual cycle irregularities,
mm.
no. Yes,
That is
during
also one myth,
pregnancy,
that it can
very
cause
different.
infertility, this
Yeah,
vaccine.
so that
So many parents are not giving this. So what would you like to say to those parents that?
we are living in a life which is very simple for us. But now you see there is something that can prevent the cervical cancer, which is 17% of the women affected here. Any 90% of the people have harbored this infection, HPV. You're
Mm,
going to be the best gift, birthday gift to your daughter if you give this vaccine to them.
awesome. You were just mentioning lifestyle plays a big role. What simple habits can reduce the risk of gynecological cancers?
So, as in form of any cancer, lifestyle is a basic need for any prevention of any disease. So, when we talk about lifestyle, we mean to say right from the time we get up in the morning, what we eat, how we think, what we do throughout, what time we sleep, everything plays. So, I would say let's start with eating the breakfast, which is very important. The nutrition that goes through your body should be absolutely a balanced diet in the sense proteins, good amount of vitamins in form of salad, fruits, carbs,
Mm,
fat in a portion that not too much of excess of the carb and fat should be there. Don't skip any meal. Don't do crash dieting. At night, I would prefer the dinner should end by 8 o'clock
mm,
maximum.
mm,
Eating late night, binge eating causes a disbalance in your hormone. So we have a hormone in our body which is called insulin. It's a very good hormone. It gets up in the morning as the sunrise. The
mm,
moment the sun is out, it gets up, 6
mm,
o'clock onwards.
mm,
But it remains active. Whatever you eat is going to absorb, get glucose into the cells, make you feel energetic.
mm.
However, this insulin goes to sleep with the sunset.
Oh,
That
is it?
means, yeah, this is how it is. This humble insulin once goes to sleep at night with sunset. If you awaken it, it gets angry. And how does it be getting up is when you eat anything, even a humble peanut to the
Mm,
extent to the small, insulin is going to get up, absorb that, convert whatever you need at night into
mm,
fat, and that is going to be deposited in your body.
mm,
So be very careful with your gut
mm,
habits. So that means gut is your second brain.
mm,
So
mm,
how you treat it with probiotic, prebiotic, what quality of food you eat, and how early you eat your dinner is very
mm,
important. Also, your sugar intake. Now, when we talk about cancer and cancer treatment, the cell that cancer cells thrives on, loves, is sugar. It becomes happy, it grows more and more. So
mm,
decrease your sugary intake, sweets,
mm,
which is very
mm.
drink a
Very
lot of
important
water.
and very